walk away for a moment, and that way the slides can kind of keep playing through. But I'm gonna, after each slide, also I have lots of skeletal casts here that we can have a look at. And so after the relevant slides, I'll kind of take a minute and we'll kind of go over these. So I'm going to go ahead and start playing the slides. So give me a minute if I have a little bit of an issue with the technology. I do apologize. So hopefully you'll be able to hear this. So we're going to go ahead and start.
Hello, my name is Megan Fry. I'm going to be giving a presentation called Dead Men Do Tell Tales on exploring demography and identity in North Lincolnshire through skeletal and isotopic evidence of early medieval burials. This is a lunchtime lecture on part of the Bones and Burials exhibit, which I hope you have had a chance to go see in person. Hello, my name. I am a current PhD candidate at the University of Florida studying bioarchaeology. I first met Rose while conducting my master's research, which focused on isotopic analysis in Lincolnshire. I was interested in diet and mobility in the early medieval period of Lindsey, and I included burials from Cleetham, Werleby, and Faunaby in that research. As part of my current degree, I am doing a certificate in museum studies, which has an internship component. Rose and those at North Links have been gracious enough to allow me to complete it here. And as part of that internship, I was a guest curator of the Bones and Burials exhibit. I have excavated under the stewardship of Dr. Hugh Wilmot at the University of Sheffield for several years. I attended his field school at the Thornton Abbey project in 2015, which you can see in this picture. I then returned to help him with the Little Carlton project and the Scrumby Field School every summer thereafter until COVID hit. My PhD research is again looking at diet and mobility, but I am looking at it more broadly geographically focused. I am building off my master's data set, including a few other cemeteries from North Links collections for this as well, specifically the Welbeck Hill and Sheffield Hill collection.
Sorry, my computer has decided to not scroll through the slides for some reason. So bear with me.
I am a current PhD candidate.
Come on.
I am a current.
There it goes. Sorry, I apologize. I don't know why I kept clicking and it was not going.
Everyone, I'm sure, at one time or another has seen when archaeologists excavate burials that those remains are usually taken to some sort of a research facility, either a museum or a university for analysis and storage. But you don't usually get the chance to see what that analysis actually entails. So today, I'm going to go through some of those methods that we use to do post-excavation analysis on burials so that we can get a better understanding about the lives that these people lived. First, I'm going to cover the skeleton and what we are looking at during analysis. I'm going to show you some of the techniques for estimating the age and the sex of an individual from features of a skeleton. Then I'm going to show you a few examples of common pathological conditions. And then we're going to discuss the isotope methods and how those are used to inform diet and mobility in the past. Then we'll have a little Q&A where you can ask me some questions and I'll do my best to answer them. Everyone, I'm sure, at one time.
I don't know why it keeps doing that. There it goes. I'm sorry about that. If you hit, I guess we're going to keep hearing the start of the slides all over again each time.
Generally speaking, cemeteries are excavated for practical reasons as well as scholarly ones, and tend to be excavated because they are at-risk sites. By that, I mean that they're located in the path of construction or roads or buildings. When that happens, they have to be removed before the construction can move forward. It also is fairly common to find old cemeteries as a result of farming activities, such as plowing. Anytime artifacts are found, it's best to reach out to your local liaison officer through the portal antiquity scheme. Generally speaking, cemeteries are There are many demographic traits that osteologists can see in the skeleton. The four main demographic features we look for are age, sex, stature, and ancestry. These types of traits are especially useful when trying to explore what life was like in the past. And by that, I mean we can look at the average age at death of a cemetery, or if one sex is more likely to die at a younger age than the other, or the average stature, which can be used as a proxy for the overall health of a population. Then archaeologists can try to interpret what might have caused these trends that we see. Thanks to advances in forensic anthropology, there are literally hundreds of traits that we can look at on various parts of the skeleton. Today, we only have time to cover a few, so we're going to spend time looking at the most commonly used ones, age and sex. So the first trait we're going to look at is age. During early pregnancy, the fetal skeleton is made of membranes and cartilage, which eventually harden into bone. This process is called ossification. As our bodies grow and harden, many of the bones eventually fuse together. This fusion happens at known rates, allowing osteologists like myself to estimate a person's age at death. So let's take a look at these three skulls. The first, to the left, is an infant, less than 2 years of age. The second is a child of maybe 4 to 6 years old. And the third is an adult, likely more than 50 years old. So how did we learn that? Well, there are 206 bones in the body, and 22 of those are in the skull, not including the teeth. The skull bones are unfused at very open at first to allow the baby to pass through the birth canal. You can see that very clearly in the first skull, where it is divided into 4 sections. Those 4 sections leave an open spot at the top of the skull called a fontanelle, which you can often see in newborns as the soft spot at the top of a baby's head. Depending on how open those sutures are in the skull can give us a general idea of a person's age, namely in non-adults. The scoring ranges from 0 to 3, with 0 being completely open as in the first skull, and 3 being completely obliterated or completely fused, like in the third skull. After each suture in the skull has been ranked, those scores are added together to create an average, which gives us a rough age range for that individual. So I have 2 adult skulls here to look at that are, these are casts from the anthropology department at the University of Florida, where I am a student. And hopefully, I know the screen shows a little tiny box, but hopefully you'll be able to see where this is similar to this third skull that I've shown, where the sutures are essentially almost completely fused. There's very little space, like you couldn't even get your fingernail in there if you wanted to. So this is very clearly like somebody who's a middle to older adult. Unfortunately, I don't have any of the fetal skulls with me because those are not casts. Those are like actual skulls, and I didn't want to take those out of the lab. And this is the male skull, who is again also a middle adult with mostly fused sutures. Move on to long bones. Other traits we use are looking at the ends of the ribs and our long bones, like the humerus and femur. They have what are called epiphyses, which are the articulating surfaces. Articulating surfaces are where the one bone touches or articulates with another bone. These are loose in infants and begin to fuse during childhood. This happens at known rates, which are different for each bone. This happens for all of our bones that have epiphyseal surfaces, including our fingers. One of the first to fuse is the upper end of the humerus by our shoulder, which happens at around 9 to 15 years of age, while the clavicle, or our collarbone, is the last to fuse between 25 and 31 years of age.
So I actually have a handful of, I have 4 different, I'm gonna pull them over here. I'll try to table in front of me. Unfortunately, I don't. So I have 4 to look at here. So this is a fully fused adult humerus. And so if you look at the end of the bone, you can see that there's no line here, right? So this is completely fused. So this person's obviously more than 15 years of age. But if you look at this one, I'm hoping you can see it. There is enough of a gap here that I can actually get my fingernail in there. It's fused, but it's not, the fusion line is not completely obliterated. So this person isn't a full adult. And then I also have the epiphyses for this infant humerus are missing. I don't know where they are in the collection. I tried to find them and to no avail. But this is actually what they look like without the fusion. So there's these free floating, little bones here. So it's a fairly decent way, especially in archaeological collections, to try to approximate age. And because these bones fuse at different times, we can kind of, again, like with the scoring of the sutures on the skull, we can score these and then get an average age of most likely for an individual. We're going to talk about teeth.
The most reliable method for age estimation in children is tooth eruption. Our baby teeth are formed while we're still in our mother's womb, and they erupt during our first 2 years of life. During childhood, our baby teeth then shed, and these are replaced by our permanent teeth. Because we know the specific rates at which these teeth erupt, we can narrow down age fairly precisely. For instance, the last tooth to erupt are our wisdom teeth, which usually happens by the age of 21. Here you can see the skull of a child whose teeth have not fully erupted. The exterior portion of the bone for both the mandible and the maxilla have been cut away, so you can see the permanent teeth in the jaw that have not erupted yet. One interesting fact to note here is that adults actually have 32 teeth while children only have 20. Children are missing all of the premolars as well as the third molar.
So these are the skull that I have a picture of here is really it's really cool. I borrowed it from the forensic laboratory at the University of Cincinnati called Cap Hill. They have it as part of their reference collection, and you can actually see the teeth in the jaw. And obviously, I'm not going to bring that because it's a real specimen. I'm not going to bring that home. But some of the ones that I borrowed, I was able to borrow a cast of another one that also they've sectioned away the bone on the mandible so that you can actually see where the teeth are in the jaw of this child. And then here is actually one of a little young child, maybe like 2 years old, compared to this one who is, as you can see here, going to start shedding some of these teeth fairly quickly. So teeth are really, really, really good ones, and they tend to preserve fairly well. So they're another good indicator in archaeological specimens for age. Because one of the issues you might run into with the skull, for instance, is because once the tissue decays, the skull's hollow, so it'll fill with dirt, but sometimes it sort of can collapse under the weight of the ground above it. And so the suture fusion method might not work on archaeological specimens, especially if there's too much damage over time, but teeth tend to preserve fairly well. Right.
The most reliable method for age estimation.
There it goes. Okay, so now we're going to talk about sex estimation.
The next feature osteologists look for is sex estimation. There are certain features of the body that are considered sexually dimorphic, which means that they are different between men and women. These traits are usually seen in the skull and the pelvis and become evident or more pronounced after puberty. We take these traits and score them based on how masculine or feminine they are, and then we take the average of all of those traits to give an estimation of if we think they are more male or more female. The next feature on males generally have more robust features, such as a more pronounced brow ridge and chin, while women tend to have softer features. Women also have sharper orbital ridges, which is the bone at the top of the eye, while men have a more rounded orbital ridge. Of these two skulls, the one on the left is very masculine, especially in the jaw, forehead, and chin, while the skull on the right has more feminine features. Notice the much softer, rounded jawline.
So I have these two lovely skulls here. Hopefully you can see them. So this is a male skull. And you can see with the brow ridge here, it's very pronounced, very robust. And because it's because of the robusticity of it, because it sticks out as much as it does, this actually tends to be a much more rounded portion of the body, the brow, the orbital ridge here, compared to this lovely lady who has a much softer forehead. So the orbits here, if you had a skull in front of you and you were to like rub your thumb sort of in that area, you can feel that it's much sharper. It's more of a corner. And then I'm going to also pull. Let me look at some jaws here too, because this is the other thing. And not again, it's not to say that like these features aren't. You can have women with stronger brow ridges and things like that. It's not. It's on a scale. Same thing with aging. It's we score things and get an average. So these are a male and female mandibles, and you can actually see on the male, if you look at it. Hopefully, I'm orienting this in a way that you can see what I'm talking about. But you can see this like flaring that's happening here, and so that is gonna be one of those really strong masculine jaw lines, whereas this is a female, so it's this kind of like softer, more rounded jaw. And then the other thing, I'm not sure. These are fairly good examples. So another feature that you can look at is called the ascending ramus, which is this portion of the jaw here, the part that's going up. And in males, it tends to be much more acute, and in females, it's softer. This female's jaw, hers actually kind of comes down quite a bit, which I'm hoping you can see instead of this very sort of square jaw.
Males generally.
There it goes. Okay.
These are the same skulls, just turned in a profile view. Here, we can see some of the features a little bit more clearly. The male skull on the left has a sharper jaw. This is called a gonial angle, which is a more 90-degree angle in men, while in the women's are more rounded. The chin is also softer and rounded in the right skull compared to the left. You can also see the brow ridge we discussed previously. The male's is very pronounced compared to the female's. The forehead is another trait to look at. In males, it's much more sloped, and in females, it's more vertical. Another very obvious portion of the skull is the bony protrusion in the back. This is called the mastoid process. This is much more robust in males than in females. And as a reminder, it is important to remember that all these traits appear on a scale, and both men and women can have some variation of these traits. These traits also vary across individuals of different ancestries. So these are other factors that need to be taken into consideration.
So since I already talked to you about the gonial angle of the ascending ramus and the jaw in general, I'm just going to show you really quick the mastoid process, which is this bony protrusion right here. And if you actually take your hand and you feel the back of your skull, you can actually feel at the base of your skull where that bone sticks out. And I don't I can't explain the evolutionary reason why it is the case. I'm sure there is someone out there that studies that and can answer that question. But for some reason, in women, they're much smaller than they are in the male skull. So, but it's right next to right back there next to the ear canal, which is pretty cool. And it's a fairly chunky piece of bone, so I feel like I've had pretty good luck with like preservation in archaeological samples. They tend to stick around, which can be kind of an issue with some of these the other features of the face. Is like these bones tend to be very thin, so they might not always preserve as well as we would hope.
These are the same skulls, just
sorry, I don't know why it keeps doing that. Okay, now we're going to talk about the pelvis.
for reasons relating to childbirth. The pelvis is another part of the body that is very sexually dimorphic and is routinely used to estimate sex. Here, the female pelvis is on the left and the male on the right, with the ones in the middle showing a range between the two. Looking at the top row, we can see the front of the pelvis. Males have a narrow subpubic angle, and women have a more wide one. This is the V shape at the very front of the pelvis. Looking at the middle row, males tend to have a heart-shaped pelvic inlet and females a more rounded one. This is the opening in the middle of the pelvis. Now let's look at the last row. This is the pelvis from a side view. We can see a difference here in the tailbone, which is also called the coccyx, which tilts forward in men. All of these traits are very important because they help the baby pass through the birth canal during childbirth.
So I have two here to look at. This one on the right is the male, and you notice how this one is a really sort of a narrow, much sharper V compared to this one, which is much wider and open. And I don't know if the screen is big enough for you to see both, if I hold both of these up at the same time. But if you actually look down through the pelvis, you can see the one on it's my left. I guess that would be your right. It's round, whereas this one almost has more of a heart shape. And so this one is a male. Whereas also the other thing you can see is you've got all this stuff that kind of sticks back. It would basically just get in the way of childbirth. And then even looking at the side, one of the features I didn't talk about, but because it's the sciatic notch is this this area right here, and it in females is much wider than in males, and again that just has to do with allowing for childbirth. I'm going to talk about disease. And I don't have as many. I do have some, but I don't have nearly as many examples, unfortunately, because we don't have that many pathological conditions in our teaching collection.
Next, we're going to look at bone alterations, which take the form of pathologies and traumas. This can include diseases and traumas that a person might suffer during life. As we have seen in the last few years, diseases can have a tremendous impact on society and the overall well-being of people. Studying how these diseases affected people in the past can allow us to understand who in society is most vulnerable, which might inform how we can better help them in future generations. Unfortunately, there are only a few diseases that leave traces in the bone. For that to actually happen, the person needs to survive the disease long enough for the bone to be affected, which is why many diseases, like the Black Death, are not actually seen in skeletons. So there's a lot of different causes for bone pathology. Generally speaking, in archaeology, we consider congenital, degenerative, infectious, neoplastic, and metabolic causes. We mainly consider these because they affect the bone directly, and we can see them in the archaeological record. So let's break this down a bit. Congenital defects occur during the developmental period while they're still growing in the womb, and they're often hereditary, so they're passed down from parent to child. Degenerative diseases are those which are caused by the breakdown of bone tissue. So this is often seen in arthritis or joint wear due to occupation. So this is something that I've seen especially in the teeth at a Native American site that I worked at many years ago, where thread was routinely wrapped around this woman's tooth, and she used it to pull these textiles taut, which caused permanent tooth wear and loss on the right side of her mouth, because she used the same spot to do the exact same job every day of her life. So the next one is infectious, which is caused by bacteria, viruses, or a fungus. The fourth, neoplastic diseases, are caused by abnormal bone growth, such as cancers. The last one I'm going to talk about here is metabolic causes, which are those resulting from nutritional deficiencies. This is seen archaeologically as lines in the teeth called enamel hypoplasias, which result from abrupt periods of nutritional stress. This is also seen in diseases like rickets, where there is a vitamin D deficiency, or scurvy with a vitamin C deficiency. There are a few examples of these in the actual exhibit cases, so it's worth checking those out if you have the time. So we're going to delve a little deeper here into some of these pathologies. Looking at congenital diseases, I have two examples here. On the left, we have osteogenesis imperfecta, which is also known as brittle bone disease. It's a heritable condition where the bone has very low density, which causes them to break very easily. Another example seen here is dwarfism on the right, which is caused by an abnormality when the bone converts to cartilage.
My baby monitor is going.
So we're going to delve a little. Here we're looking at degenerative diseases. Degenerative diseases, as I said, are often caused by occupational stress or by age. Here we can see an example of osteoarthritis. These both would have been very painful for the individual during life. The left image shows marginal lipping on the lumbar vertebra, which is the lower portion of the spine. The right shows the bottom end of the upper arm at the elbow. This is what is called eburnation, which is where the bone rubs against a hard surface, or in this case, another bone. This resulted in deterioration of the joint surface.
So I have one example of some of this. This is a tibia. So this bone has got a lot of lipping and extra growth on it, which probably would have been pretty painful, I would imagine, to walk around on during life. So.
Infectious diseases are a little bit trickier. They can be harder to identify because something like a cold won't show up in bone. As I said previously, the person had to live long enough, and the disease had to be severe enough for it to affect the bone. In these two images, we have the left, which are a picture of x-rays of someone suffering from leprosy, which has affected both of their hands. The right shows someone suffering from syphilitic lesions of the skull. Like tuberculosis, it is fairly easily transmitted and it affects the skeletal system, but it can lay dormant, or rather undetected, for long periods of time, so it's easily transmittable.
I have an example of this, but my daughter is crying in the background, so I need to.
Do you want me to take over doing the slides? Like, do you want to go grab her?
Just just for a minute, if you don't mind. I think, and I'll be right back.
Yeah.
Sorry, thank you. I'll come back to showing you some of these examples. She's just, I can hear her.
It's fine. Now, if you've got any questions, then do feel free to put them in the chat. Everyone knows where that is. On the top, you should have a little bubble that says chat underneath. I think we're going to be joined by hello, baby.
Rescue came over and was able to take care of her, so we're okay now. I'm back.
Right. Okay. I didn't move it on. I'll leave you to it.
Okay. All right. So I was just gonna show you. Sorry, I've lost my train of thought here. And in the interest of time, I don't want to spend too much time waste too much time on this, but this is an example of syphilitic lesions, same as the picture on the right. And this is actually the top front of someone's skull that lived with that for a very, very long time for it to get that bad. It's interesting. It's interesting that we were able to have a cast of that. Okay. I'm going to go on to the next slide. And I'm sorry if you guys do have questions. I promise at the end we'll take a minute. I just have to kind of whiz through these. Okay.
Here, we're looking at neoplastic illness, which is caused by uncontrolled growth, such as cancers and tumors. This is an example from a modern medical collection where the bone has been sectioned or cut in half, so you can see the inside of the tumor. This is a young adult femur with a very large mass at the proximal midshaft. So this would have been a big lump on the top of their leg near the hip. I believe there is also a good example of this from the Lincolnshire Eastern Bypass Project, where there was a skeleton with a large tumor found in their abdomen. But I was unable to find a picture of this.
I unfortunately don't have any examples to show you from that, so we don't have any of those in my collection.
The last one I'm going to talk about here are metabolic causes, which are those resulting from nutritional deficiencies. This could be due to illness, such as a fever, a parasitic infection, or resulting from a lack of food, maybe from a bad harvest. These are seen archaeologically as lines in the teeth called enamel hypoplasias, which result from abrupt periods of nutritional stress while the teeth are forming. You can see this in the image on the right. Since this happens while the teeth are forming, you know that this happened during childhood. Some research has also interpreted in certain cases as it being from weaning episodes, so transitioning from breast milk to solids in the past. Looking at the image on the left, this is an example of cribra orbitalia, or cranial lesions, on the upper roof of the eye socket. Traditionally, archaeologists have associated this with an iron deficiency anemia, but several more recent papers have said that this is actually a result of several different kinds of nutritional insult episodes. The other issue is that cribra can come and go throughout someone's life, so it's hard to associate it with one specific event. Other metabolic diseases that we often see are rickets, where there's a vitamin D deficiency causing bone bending, especially in the long bones, or scurvy with vitamin C deficiencies, which can cause lesions in the mouth. There are a few examples of these in the actual exhibit cases, so again, it's really worth checking out if you have time.
Unfortunately, I don't have any examples of these in like my person because the ones that we do have them again were on actual bone, and I'm not going to take those out of the lab. But these are the two that we normally we see quite often in archaeological populations. So they're really good, a really good tell of like the health of the general population.
second type of bone alteration we will consider here is trauma. This could be the result of an accident or an intentional assault, like in a battle. There are two types, ante and perimortem trauma. Antemortem trauma happens during life, and the bone will show signs of healing. After a bone has been injured, bleeding occurs at the fractured edges, and after about a week, the woven bone will be visible at the site of the fracture. This eventually develops into a fractured callus, which will gradually harden as the bone heals. This callus will remodel over time, but the site of the fracture will still be visible as a slight deformity. Here you can see antemortem trauma on the left, which is noticeable by the healing and woven bone. Perimortem happens close to death, so there is no sign of bone remodeling. Here you can see it on the right because there are clean fracture lines, no woven bone, no calluses, and a consistent coloring. When bones were broken in the past, they didn't have the technological advancements we do today to be able to set them properly, so they're fairly easily to spot in the archaeological record. Archaeologists are also able to look at certain types of bone trauma to infer if, for instance, they were criminals and killed as a result of their crime, like if they were hanged or beheaded.
So I have one example from our collection of a cast of someone whose right leg broke. Their femur broke at some point during their life, and it was not properly set, and it healed in what I can only assume is an excruciatingly painful sort of way. And all of this new bone growth tells me that this person lived like this for quite a long time. They survived it and miraculously did not get some sort of severe infection and were able to live the rest of their life with this break. But they probably were also, I would assume, maybe walked with a limp and maybe even had were slightly shorter on one side. But it's an amazing example that we have in this in this collection. Unfortunately, I don't have any skull trauma examples to show you.
Next, we're going to shift over to isotope analysis. But what are isotopes? All things are made up of tiny particles called atoms. These are made up of a few even smaller particles called electrons, protons, and neutrons. An isotope is an atom of the same element, such as carbon, that has the same number of protons and electrons, but a different number of neutrons. We can use these isotopes to explore diet and migration in past populations. There are two main tissues that we use in archaeology to study isotopes. These are bone and tooth enamel. Because of the way that these isotopes incorporate into our bones and teeth, we get different values for different times of life. Teeth show early childhood, while bones show the last 7 to 10 years of someone's life. So let's think back to when we were discussing enamel formation. We know that our baby teeth are formed while we were in our mother's bellies, meaning that an isotopic signature of baby teeth are actually going to reflect our mother's diet. Permanent teeth, on the other hand, form during early childhood. Generally speaking, I look at permanent teeth, but there's an issue there as well. So all of our anterior dentition, these are the teeth near the front of our mouths, like our incisors and canines, even our first molars, would have formed while we were nursing. So this is still going to reflect the signature from our moms. However, not all of our teeth form during that pre-weaning phase. Mainly our second and third molars usually form after weaning. So I can compare the isotopes in the enamel from the first molar to those of the second or third molar to look at how diet shifts throughout childhood. Next, we can compare those values to the values that we see in bone, since we know that new bone remodels throughout a person's life. So we can see some interesting patterns when we compare the values of carbon, for instance, from bone to those of the carbon signatures from our tooth enamel. There are two main types of isotopes that archaeologists use to study diet: carbon and nitrogen. Carbon comes from the plant portion of our diet, namely carbohydrates, and different plants will leave different isotopic signatures. Carbon can be either C3 or C4. C3 foods are those like wheat, rice, and barley. These will range from -20 to -35, and they are found in temperate climates like Lincolnshire. C4 foods are those which, like maize, millet, and sugarcane, and these range from -9 to -14 and are found in hot, arid environments. The second isotope archaeologists look at for diet is nitrogen, and is generally made up of the protein portion of our diet. Nitrogen is measured in trophic levels. Every step up the ladder increases about 3 trophic levels of nitrogen per mil. We use per mil here, which means out of 1,000 compared to the standard percent, which is out of 100. Plants are the primary producers of nitrogen. They are found at the bottom of this food chain. Herbivores, such as insects or sheep, eat only plants. Omnivores eat both plants and animals, for example, birds, which eat insects and seeds. Carnivores eat only meat, like foxes or tigers. Humans fall somewhere between omnivores and carnivores on this trophic scale. Next, we want to think about where their food comes from. If you live near water, you're likely going to eat more fish than someone who lives inland. Archaeologists call a diet that relies heavily on fish a marine diet, and one that relies on hunted or farmed food a terrestrial diet. Archaeologists can compare the carbon to the nitrogen to determine how important seafood was in their overall diet. We learned that we get carbon from the plants that we eat, but the other way that we get carbon into our bodies is from fish. Fish get carbonate from the sea floor, which can then be stored in our bones when we eat a lot of fish. We also learned that nitrogen can tell archaeologists how much meat an animal or a person eats. Because there are many types of fish, they tend to have more steps in their trophic ladder. So people who eat a lot of fish have even more enriched nitrogen levels. That means that they will have a higher level of nitrogen than someone who eats more land animals. Archaeologists compare the nitrogen and carbon levels to better understand a person's overall or whole diet. So let's talk about migration. There are 3 common isotopes archaeologists use in migration studies. These are oxygen, strontium, and more recently, lead. These isotopes get into our bones and teeth from the environment, often through our drinking water. It can tell us if a person lived in an area during the time that tissue was formed. So think back to when we were discussing the difference between bone and tissue formation and the timings of those formations. Let's look at the third molar specifically. The enamel forms during early to middle childhood, so it would show where someone lived when they were, say, 5 years old. Let's look at the 3 maps. These come from the available data on the British Geologic Survey website. The first one shows oxygen from drinking water across the United Kingdom. Notice the shift in color is from east to west. The middle map is lead, which changes color from north to south. And the third is strontium, which is less obviously defined, but still really useful. For instance, let's think about if we found a burial in, say, Hull. We would expect its strontium reading to be 0.7080 to 0.7090. But if the reading comes out to be 0.7150, for instance, we would know that they likely lived in the northern portion of Scotland during childhood. For someone who was born and raised in this area, Scunthorpe, the readings would reflect the ones I've listed on the far right. I've also color-coded these to match the map readings to make it easier to follow.
I realize now that I did not include the values of the legend for strontium. For some reason, I somehow cropped that out. But the other thing I didn't do was color code the lead map. because I usually try to avoid, if I can, reds and greens to help with color blindness. So if somebody is having issues, vision issues seeing it, let me know, and I can try to send you a different color coded version of that map.
Now let's have a look at the local signatures. Lindsay is the early medieval Anglo-Saxon kingdom that made up the northern portion of Lincolnshire. I studied skeletons from this region and period for my master's research. I compared the isotopes and pathological conditions from this area to the surrounding kingdoms. This map shows the sites I sampled, 4 of which came from North Links. The other 2 were stored at the collection in Lincoln. Here are the isotope values of Lindsay compared to the other kingdoms. Carbon is on the horizontal axis and nitrogen is on the vertical axis. Although there is some overlap for the standard deviation, there is a difference in Lindsay compared to its contemporaries. Notice the blue dot clustering farther away from the others. Remember back to the pathology we discussed. Comparing linear enamel hypoplasia, those lines in the teeth, Lindsay had a much higher rate than East Anglia, but a lower rate than Kent. This indicates that there was a difference in overall health during childhood between these regions. For Kerber orbitalia, the pitting and the roof of the eye sockets, there wasn't much difference between the regions, though.
Sorry about that. My computer battery flashed at me and said it was about to die, so I just had to run and grab my charger. The other thing to consider when I was comparing these different the different kingdoms is that there's a huge disparity in the sample size. So for Lindsay, I only had, I think, 43 individuals, because I was able to pull a handful that was, I believe Simon Mays and Bevan Mays pulled them years ago from Castledike and include those as well. But, you know, comparing 43 samples to what is the biggest one, like Mercia, which has 690 individuals. So because that there's a different sample sizes, there's going to be a little bit of a skew for what the isotopes show.
Bones can tell us a great deal about the past. We use scientific methods to study identity through burials by looking at isotopic traces in bones, as well as skeletal markers of age, sex, trauma, and disease. Scientists use these methods to learn who we are from who we once were. I hope this presentation has been interesting and informative and enticed you to go see the exhibit in person.
So that is my presentation. I hope that you found it interesting. I realized it was a lot of information thrown at you all at once. So I'm happy to try to field some questions. I will do my best to answer them. I am going to, Rhodes, if it's all right, I'm going to stop screen sharing because I don't know that it's necessary at this point.
Yeah,
that way too, I can make the little box, the window bigger if people want to see a bigger screen of if they want to see something on some of the bones a little bit better. Is that all right?
Yeah, that's fine. Yeah, no problem.
Did that work? Yeah. Good.
Yeah.
Okay.
Yeah.
I appreciate you all. I can't believe there's this many people that were that to see me talk at you for a minute. I hope that it was interesting. Is there any questions that I can try to answer for you? I can do my best. Well,
if you have a question, you can either put it into the you can put it in the chat, or you can unmute yourself and just shout it out. Or if you want to, you can raise your hand as well if you want us to find you. So I'll start you off with one. So I went into my son's school the other day to do an Anglo-Saxon day, and a class of 7 and 8 year olds. Obviously, they're really interested in skeletons, and we talked about how we know what we know about the Anglo-Saxons from the burials. And one of the questions that one of the year 4 asked was, who was the oldest Anglo-Saxon, which obviously was a very difficult question to ask. So we talked a bit about how you can't be really precise with aging a skeleton. It's kind of in a band, a child or over whatever age. So the follow-up question that I got was, are we ever going to be able to find out who's the oldest Anglo-Saxon? And I know we can't, but I wondered if there was any kind of new dating techniques that were being developed that could make dating of skeletons any more precise.
So there is I believe, I am almost 100% positive it's called transition analysis. So one of the things that I like to do is, if you look at the, I think it's the American Association of Forensic Anthropology or something like that, their website, whatever the big organization in America for forensics is, they actually have on their website, they have a list of like the most up-to-date standards that they use. And one of the ones that's in the works that's supposed to be significantly better is called transition analysis. And it takes like, I think, I want to say it's like 100 and something like measurements and things that you use, and you plop it all in. And it spits it out. It's like, and so that's what a lot of these things are moving towards, is like computer generated things where you put the data in and it'll give you a reading. But I do know that I just went to a talk. I talked to somebody recently about the transition analysis thing, and they've said that they're reworking it a little bit. So I do think that yes, it will get better, but they're still feeding it data to, I think, try to train the computer to do what it needs to do. But I'm pretty sure that one's for age. And unfortunately, the older skeleton is, the less precise you get with aging. It's like kids, because of the teeth especially, you can be really precise. But once everything's fused, you're just like, they're over 50, and that's kind of where you get to middle age-ish time, and it just kind of is like, okay, well, they're that, unless they tend to have like a lot of arthritis, or like they're missing all of their teeth. That might be another way of kind of determining. I can hear Zelda in the background. Give me 2 seconds. I'm just going to pick her up.
Great, I'll be able to go back to the class and say I have an update on your question. She kept coming back and saying, but can you find out? But will you be able to find out?
I fully believe there are so many people studying forensics. I wholeheartedly believe that there will be ways to be even more precise over time, assuming that the preservation is good, because that's another issue that you deal with, right? Is like, if if all you've got is a handful of bits that have been, plowed through, it makes it a bit more difficult. Everyone, hello, this is Zelda. This is my grumpy little baby. Has her hair brushed for some reason, but yeah. So no, she just woke up, so she's okay right now. She gets middle afternoon and she starts to get a bit of a grump.
Right, so we have a question from Tim. So Tim says, thanks for an interesting talk. Were there any surprises, negative or positive, in what you found out about Anglo-Saxon Lindsay's diet?
No, not particularly. There was one burial from Fonaby. So Fonaby in general has the preservation's really kind of, it's very sad. I think if I remember correctly, the whole collection fits in a very small box, right? Yes, I know. And so the preservation was kind of terrible. So I was only able to pull, I think, for 3 individuals for that site. And of those 3, one of them was too contaminated to actually produce any usable reading. So that left me with 2 individuals, one person who fell into the range with everyone else, and then one person who was completely off the charts different from everybody else. But I also, I think that person's diet indicates that they were probably either they had some sort of like long-term illness or diet restriction, or they were just from somewhere else. So they had a different diet in the period leading up to their death, and they happened to die in that region. But so theirs were quite different. But I also have to kind of look at that with a grain of salt again, because it's a really small sample size, and also the preservation is really terrible. And I don't really know enough about the area where Fonaby was found to know why the preservation is the way that it is. Maybe Rose, maybe you have a better idea of what that region looks like, but the preservation's not great, so it makes it a bit difficult.
The site, when it was the site was damaged, I think it had been disturbed, and the building works were taking place, and the site was kind of exposed as well. And I think lots of people were going on and moving stuff around and digging for treasure. So there was a lot of the graves got disturbed as it was being excavated even, and there was an element of rescue excavation having to take place. So I don't think as much was recovered as if it had been done in a nice scientific way, unfortunately. Yeah, but and also the sand, the condition, the soil conditions are quite acidic as well, and I think that that obviously affects what bone is there. Yeah.
Is that true? Maybe I know I'm not really the one supposed to be asking questions, but is that kind of true for like when I feel like is it in Scotland that has a lot of the ones that are like sand burials where it's just like a smudge of color of where a person was buried? Is that up north?
Sutton Hoo as well. Some of the burials at Sutton Hoo are just, it's the staining, isn't it? It's the staining on the soil. It tends to be the sandy soils there, and you get the staining of the outline of the body, but there's all the organics have gone. That normally those kind of conditions are really good for the metalwork, but not so good for the bodies.
Yeah, no, that
And
makes
so
sense.
some of the burials that Kevin's been looking at Sawcliffe, they were sand burials. That's why Sheffield Hill, that's why there's not masses of really good bone material from there. There's fragments, but the metalwork's excellent.
Yeah, and I do have some of those bones that are some of those bits are going to be run through the mass spec. I'm hoping, I bet the machine was down for like 6 months. We were waiting on a part and you couldn't get things. Anyway, the machine is back up now, so I should actually be able to run those, and I'll get that data to you soon because that'll be interesting to see what's happening in that region as well. I'm sure Kevin will like to see it, if nonetheless. But
Yeah, it'll all go into all go in the book. So we've got another question that's coming from Catherine. So how can you tell the difference between an Anglo-Saxon and a Viking? I'm thinking about the validity, credibility of ancestry DNA tests and the link with skeleton's identity.
oh, okay. So I don't really do the DNA portion of things. I've done DNA research in the past, but it was on a modern population, and so I'm not going to be the person that's going to be able to answer a super good DNA question. But I do know that, I mean, I think that the diets were fairly similar, but I can actually I can check on that. But I would assume that the diets were fairly similar. And so the readings for isotopes at least are going to be somewhat the same. Unless it's metal finds, like grave goods, right? Like if I think like especially metalwork, right, is really stylistically specific between Anglo-Saxons versus Viking materials. Unfortunately, I can't answer the DNA question though, because I don't. That's not something that I study. Unfortunately, I'm not that smart.
Everyone wants, when they're doing the DNA, they're always like they're looking forward to being a Viking, but really probably all they're finding out is that they're Northern European, isn't it? I think Catherine's typing an answer or another follow-up question on that as well.
Sorry, Catherine, I don't have a better answer. I bet I could probably find some papers for you though, if you would like. I could take your email and I can send you some papers that are more recent on it. I'm happy to.
Thanks. Depends, of course, if someone took a fancy to wearing Viking goods, so that could confuse. Yes, absolutely.
Yeah. Absolutely, yeah, especially with like trade and things like that. Absolutely.
So, does anyone else have any more questions? No, no one's putting their hand up. There's nothing coming in.
I hope that everyone at least enjoyed it. I haven't done a talk for a museum. I'm used to talking at a bunch of 18, 19-year-olds that are there because they have to be, not because they want to be. So I hope that you enjoyed it, and it wasn't too much information throwing at you. I tried to pick and choose the interesting bits. So
it was great. There's someone else is typing something. I can't see the name. I can just see the little dots that tell me someone's typing something. So I'll see what that is. So I've got a quick question. What's out of all the burials that you've studied in Lindsay, which has been the one that's your favourite, or you think is the most interesting?
Oh, I have to talk to Hugh about that one. So the burial that gave me the biggest headache, but was also really fascinating, was one at Scrimby. I think it was the third. Maybe it was the third year that we were there. It was an adult woman and her infant baby. And I know that there's photos of this burial in the news and stuff. So it was covered fairly widely. But she also had, so she was on her side, and the infant was cradled in her arm. And then there were over 500 amber beads that were on a string that were placed over top of the body, along with I can't remember. I think she might have also had like an ivory bag ring and something else. It was very cool. It was a very cool, very richly furnished burial. But I've never seen that many beads in one place. And having to hand draw and give each individual bead a context number, it took forever to get that burial out of the ground. But it was amazing. It was such a cool burial. In general, Scrumby had a lot of really interesting burials. They were all sort of kind of all over the place, but they were really cool. But that one, that's always the one that anytime anybody asked me what was my favorite burial, I was like, it was my favorite and least favorite all at the same time, solely because it took a long time to get her out of the ground. It's very meticulous work, but it was very cool. So I look forward to when they publish on that site, because I'd like to see what the interpretations are and stuff on it.
Yeah, definitely. So the 3 dots are still there, but no messages appeared. So
she's starting to get grumpy. Sorry, I'm trying to distract her as much as I can.
So does anyone else have any other questions or comments or anything that they'd like to say? Oh, Kat, a question I get from children at the museum all the time: can archaeologists tell what people's skeletons look like when they're alive?
I have never had that question. I've never really thought about it. I feel like, I mean, maybe if somebody is really good at path and they were walking, you saw somebody who's walking with a severe limp and is maybe 2 inches shorter on one side, you might assume that they have something. I mean, obviously, hopefully in modern day and age, they're not going to have like this sort of a problem. Like it would be at least, set properly in a hospital. But I cannot. I would not say that I am clever enough to know. I'm not Bones. I don't know what I can't look at somebody and be like, oh, this person's got this, I'm not that clever. But that's an interesting question though. It's a good thought. Bit grim, but
they can do facial reconstructions and get an idea of what someone might have looked like on their by building up the muscles and the tissues on the skull. But yeah, I've never seen any reconstructions where they've worked out what someone's body would look like on the skeleton.
Yeah. So yeah, no, I don't think that's something that we don't really no, not that I know of. I mean, I think it's pretty. You can sometimes, if somebody's muscular, like their bones are, say they where the muscle attachments are, say there's like really robust muscle attachment points on the bone, you can assume that they had big muscles or something like that. But you can say they were maybe a bit more robust. But in general, like aside from that, I don't, to my knowledge, I don't think we really do anything like that with the body. So, but yeah, no, unfortunately, I don't have a better answer for that one.
That was a good answer. It's the answer, isn't it? So, is there any more questions? There is someone else is commenting. I don't know if it's the same person's little dots that keep popping up, and then maybe they're struggling to put a question through. Well, I'll just say I think that's draw it to an end now. It's 2:05. That was really great. Thank you very much for joining us all the way from America and doing this talk. It was super. So we have recorded it, and so we will be able to share it with if anyone wasn't able to see all of the talk, or if they had to nip out, then we will share it with people who've attended so they can catch up. And yeah, so I'll just say thank you very much and round of applause.
Thank you. I also, on the slides, I sent you a copy of the actual slides. If you ever need to use them for anything, you're welcome to. My contact information is actually on one of them. If anyone has any questions, feel free to email me. I'm happy. I will do my best to try to answer the questions. So yeah, please feel free to. That is absolutely fine.
Thank you.
That was a good yawn.
She's like, oh, mummy, it's so boring talking about skeletons.
I know. It's okay. Anyway, well, thank you so much. I should pop off and go get this child some food and change her clothes and stuff. But I appreciate it. Thank you so much for letting me talk to you for a bit.
No, that was super. Thank you very much. Bye, everyone. Bye. Bye.